As we grow older, the idea of being alone during an emergency can be incredibly unsettling, especially when it comes to something as serious as a stroke. But what if I told you that there are a few simple, powerful actions you can take right away, even if no one is nearby, that can greatly increase your chances of surviving a stroke? For seniors, this is not just a theoretical concern, it's a very real possibility. This video is made especially for you, the wise and experienced generation, 60 and beyond. I want to share with you 5 life-saving tips that could make all the difference if you ever find yourself in the frightening position of dealing with a stroke on your own. No jargon, no unnecessary details, just clear, easy-to-follow advice designed to help you act quickly, confidently, and most importantly, to save your own life. The best part, it's easier to remember than you might think. And trust me, the knowledge you're about to gain could truly be the difference between life and death. So, let's dive right into these practical tips, and I promise you'll feel more empowered and ready to take action should the unexpected happen. You've lived a full life. Let's make sure you're equipped to keep living it even in the face of adversity. Stay with me, because this could be a lifesaver. Let's get started. Tip 1. Recognizing the signs and acting fast. When it comes to surviving a stroke or heart attack, the very first thing that can make or break your chances is recognizing the warning signs and acting quickly. For seniors, this is especially important. Time is of the essence. Every moment without treatment puts your brain and heart at risk of permanent damage. Many of us tend to brush off mild symptoms, thinking it's just something like indigestion or simple fatigue. But waiting too long can be dangerous. For example, let's think about James, a 73-year-old retired teacher. One morning, while reading his paper, he suddenly felt numbness in his face and weakness in one arm. Instead of ignoring it, he took action and called emergency services right away. That quick decision made all the difference. He was treated early and made an amazing recovery. Why is early recognition so important? Well, strokes and heart attacks often begin with subtle symptoms. A stroke might start with confusion, difficulty speaking, or numbness or weakness on one side of the body. A heart attack can begin with chest discomfort, shortness of breath, cold sweats, or dizziness. Unfortunately, many seniors overlook these signs or hesitate to call for help, worrying they'll bother someone or overreact. But here's the truth. Acting quickly saves lives. It's never a bother to ask for help when you need it the most. From a psychological perspective, fear and denial can cloud your judgment during these moments. It's natural to think, I'll wait and see if it passes, but delaying can be deadly. If something feels off, trust your body and take action. Calling for help isn't just a step in survival. It's an act of self-care. It's empowering, especially for those who may face these emergencies alone. So, the first life-saving tip is to educate yourself about the signs of stroke and heart attack. Learn to recognize them so that, when the time comes, you can respond immediately. Don't ignore your body's signals or worry about causing a fuss. Respond with urgency and confidence. Keep emergency numbers handy, and if you can, consider wearing a medical alert device. This proactive approach isn't just about knowledge. It's about adopting a survival mindset. Especially for seniors who may face these events alone, it's crucial to remember that the difference between acting quickly and waiting could be the difference in your health and the length of your life. Tip 2. The power of self-help techniques when you're alone. When faced with a stroke or heart attack, especially when you're alone, the sense of isolation can be overwhelming. The fear of being powerless in such a critical moment can be terrifying. But I want to remind you, you are not helpless. There are life-saving techniques you can do on your own, even before the paramedics arrive, that can protect your heart and brain. These simple actions could make all the difference. One of the most important self-help techniques is the cough CPR method. This technique can help maintain blood flow and keep oxygen circulating through your body while you wait for emergency responders. Let me share a story about Helen, a 78-year-old grandmother who lived by herself. One afternoon, she suddenly felt the crushing weight of a heart attack. But Helen had learned about cough CPR from a health seminar. Without hesitation, she started coughing forcefully every couple of seconds while dialing 911. That steady action helped keep her conscious and stabilized until help arrived. Why does cough CPR work? Coughing forces your heart to pump blood, preventing it from stopping completely, which is especially important in the first few minutes of a heart attack. These minutes are critical, as every second counts in keeping your heart pumping. While this method isn't widely known or taught in most medical advice, it could mean the difference between life and death for seniors living alone. In addition to cough CPR, simple breathing exercises can also be a lifesaver. Deep, slow breaths help calm panic and increase oxygen levels, which is essential when your heart is struggling. These breathing techniques can support your body through the crisis, keeping you stable as you await help. Now, I understand that it might be difficult to consider using these techniques because you might worry about doing something wrong or making the situation worse. But here's the truth. The risk of inaction is far worse than the risk of trying. The more you practice and prepare, the more confident you'll be. Training yourself to respond quickly in these situations isn't about being a medical expert. It's about being proactive and ready to take simple, effective actions that could save your life. Helen's experience is a perfect example. When her heart started pounding and the chest pain struck, panic could have taken over. But instead of letting fear control her, she stayed calm, used what she knew, and kept coughing steadily. She even managed to dial 911. Her calm resolve and swift action kept her alive until the paramedics arrived. So, the second life-saving tip is to equip yourself with practical self-help techniques and prepare mentally to use them confidently. You don't need to be a medical expert, but by learning and practicing these techniques, you can increase your chances of surviving a stroke or heart attack. It's about being ready to take simple steps that protect your life. If you've found this information valuable, I'd love to hear from you. Just leave a comment with number 2 below to let me know you're here. And if you haven't subscribed yet, I recommend doing so you don't miss out on more helpful tips. Your support keeps us motivated to continue sharing vital content to inform and inspire you. Let's continue moving forward. Tip number 3. The critical role of recognizing early warning signs. For seniors, one of the toughest challenges during a heart attack or stroke, especially when you're alone, is recognizing those early warning signs quickly and accurately. It's easy to dismiss subtle symptoms as just part of getting older or as something related to a chronic condition. However, this delay can be deadly. Knowing what to look for and trusting your instincts could mean the difference between quick action and a tragic delay. Let me share Carl's story. Carl is a 75-year-old retired teacher who was going about his usual quiet morning when he suddenly felt a mild yet unusual discomfort in his chest. Instead of ignoring it, Carl remembered the importance of listening to his body and decided to act quickly. He knew the signs of a heart attack, and this moment of discomfort wasn't something he could afford to overlook. Heart attack symptoms often include chest pressure, shortness of breath, sudden weakness, cold sweat, or nausea. For strokes, the signs can be sudden numbness or weakness in the face, arm, or leg, especially on one side of the body. There might also be confusion, difficulty speaking, or a severe headache. These symptoms can be subtle or fleeting at first, but ignoring them could be disastrous. Carl felt mild chest tightness and a bit of dizziness, but he didn't panic. Instead, he immediately sat down, took steady breaths, and reached for his phone to call emergency services. Recognizing the signs isn't just about spotting physical symptoms, it's also about understanding what's normal for you and what isn't. Many seniors live with chronic conditions, and these can sometimes mask or confuse the warning signs of a heart attack or stroke. This is why education and awareness are so important. Carl had taken the time to educate himself through health workshops and had regular discussions with his doctor about his risks. This gave him the confidence to act decisively when the symptoms appeared, which likely saved his life. Psychologically, understanding the early warning signs helps combat denial and fear, two responses that can cause hesitation in an emergency. When you know what's happening, you can move from confusion to action. Carl's ability to recognize danger allowed him to overcome fear and call for help immediately, even though he was alone. His emotional readiness, alongside physical preparedness, played a crucial role in his recovery. It's also important to share this knowledge with those around you, family, friends, and caregivers. The more people who understand these signs, the better your chances of someone noticing if you're unable to ask for help yourself. But ultimately, the responsibility for recognizing these signs starts with you. Regular checkups, conversations with your doctor about your risk factors, and keeping a symptom journal can help you understand your body better. The more you know your own signals, the better prepared you'll be. Another key part of recognizing early warning signs is immediate response. Once you notice these symptoms, don't hesitate or second-guess yourself. Call 911 right away and clearly describe what you're feeling. Paramedics can begin life-saving treatment on the way to the hospital, which can make all the difference. Carl did exactly this. He didn't wait for his symptoms to worsen or disappear. He called for help at the very first sign, which led to quick intervention and a full recovery. Many seniors worry about being a burden or overreacting, but when it comes to strokes or heart attacks, every minute counts. Carl's story is a reminder that acting early, even if it feels uncomfortable or embarrassing, is critical. Your life is worth more than any temporary discomfort or worry. So the third life-saving tip is to educate yourself about the early warning signs of stroke and heart attack, and trust your instincts to act quickly. This knowledge and confidence are your first line of defense in protecting your life, especially when you are alone. Tip number 4, the life-saving power of the right positioning and breathing techniques. When a heart attack or stroke strikes, especially when you're alone, it can feel like everything is out of your control. But here's something powerful you can do. How you position your body and control your breathing can dramatically affect your chances of survival. It's not just about waiting for help to arrive. Your immediate actions can ease your symptoms, improve your oxygen flow, and reduce the strain on your heart and brain. Knowing these techniques is essential for every senior. Let me share the story of Helen, a 78-year-old woman who had a mild stroke while alone at home. She suddenly felt weakness on one side of her body, and fear quickly set in. But she remembered advice from a community health seminar she had attended. Helen sat down, leaned slightly forward, resting her elbows on her knees, and began taking slow, deliberate breaths. This simple adjustment helped her breathe easier, reduced dizziness, and allowed her to stay calm until paramedics arrived. Why is positioning so important? Proper positioning during a stroke or heart attack can help manage symptoms and prevent complications. For example, sitting up or leaning slightly forward can relieve pressure on the lungs and heart, making it easier to breathe and easing the strain on your heart. Lying flat, on the other hand, could worsen symptoms like shortness of breath. If you feel dizzy or lightheaded, try to sit or lie down to avoid falls, but avoid lying flat unless absolutely necessary. Breathing plays a huge role too. Deep, slow breaths can help you maintain oxygen levels and calm your nervous system. Breathing calmly is vital because panic can raise blood pressure and increase oxygen demand, which only worsens the situation. Helen practiced inhaling slowly through her nose, holding her breath for a few seconds, and then exhaling gently through pursed lips. This method allowed her to stay composed and take in more oxygen during the emergency. These techniques are not just about physical benefits, they also help emotionally. Fear and panic are natural in such situations, but they can cloud your judgment and drain your energy. By focusing on your breathing and body positioning, you create a sense of control and calm, which improves your ability to think clearly and act decisively. Seniors who prepare themselves with this knowledge and practice these techniques regularly are better equipped to handle emergencies. By practicing breathing exercises daily, you build muscle memory so that, in a crisis, these techniques will become second nature. Helen's story is a perfect example of how small, simple actions can make a life-saving difference. It's also essential to have a phone within reach, ideally with emergency numbers pre-programmed, so you can call for help immediately. Combining proper body positioning and controlled breathing with prompt communication can dramatically improve outcomes. Remember, these strategies are not substitutes for medical care, but they are crucial first steps to support your body when immediate help isn't available. They help buy precious time, reduce complications, and increase your chances of survival. Empowering yourself with these tools means you can take control of your health even in the toughest moments. If you're still watching this video and finding these insights helpful, please comment number 4 below to let me know you're here. And if you haven't subscribed yet, please do so and turn on the bell so you don't miss any important videos. Your support helps us continue creating content that informs and inspires. Let's move forward together. Tip number 5. The critical importance of recognizing early warning signs and acting fast. When facing a heart attack or stroke, especially when you're alone, time is not just precious, it's life-saving. The quicker you can recognize the early warning signs and act on them, the better your chances of survival and recovery. This is especially true for seniors, whose symptoms may be subtle or mistaken for something less serious. Let me tell you about Robert, a 72-year-old man who experienced unusual fatigue and mild chest discomfort one morning while at home alone. Instead of ignoring it, Robert remembered the importance of recognizing early symptoms and immediately called emergency services. Because he acted so quickly, the doctors were able to minimize the damage to his heart and save his life. His story illustrates how recognizing the signs and acting without hesitation can make all the difference. Early warning signs you should know. For a heart attack, you may feel chest pain or pressure, shortness of breath, nausea, lightheadedness, or pain radiating to your arms, neck, or jaw. And for a stroke, the signs include sudden numbness or weakness in the face, arm, or leg, especially on one side, confusion, trouble speaking or understanding speech, difficulty seeing in one or both eyes, dizziness, loss of balance, or trouble walking. These symptoms may appear suddenly or develop gradually, but they are always urgent. The problem for many seniors is that these symptoms can sometimes be dismissed as normal signs of aging or linked to less dangerous conditions like indigestion or simple fatigue. But this mindset can be deadly. Ignoring these signs could cost you precious time, leading to permanent damage or even death. Why early recognition matters. One reason early recognition is so crucial is that treatments like clot-busting drugs or emergency surgery work best when administered quickly, often within the first few hours of symptom onset. Every minute counts, and delaying medical care only increases the risk of permanent heart or brain damage, disability, or death. For seniors, especially those living alone, having a clear plan of action is critical. You should always have emergency phone numbers accessible, know how to describe your symptoms clearly to dispatchers, and even alert neighbors or friends if possible. Being proactive can speed up response times and improve your chances of a successful outcome. Overcoming fear and denial. Psychologically, fear and denial are common responses that often delay action. You might feel embarrassed, thinking the symptoms will pass, or that you don't want to trouble anyone. But these feelings can put your health at great risk. Asking for help is a strength, not a weakness. It's essential to recognize that acting quickly is crucial for survival. Educating yourself and your loved ones about the early warning signs can make a huge difference. Regular health checkups, educational programs, and open conversations about potential emergencies will give you the knowledge and confidence you need when the unexpected happens. Robert's story reminds us how important it is to know the signs and respond immediately. It's not just about avoiding panic, but about understanding what your body is telling you and acting quickly to get the help you need. Taking action early saves lives. Preparing yourself to act decisively and without delay is the best defense you have in an emergency. This knowledge is your first line of defense in protecting your life when you're alone. By recognizing the warning signs early, you can dramatically improve your chances of survival and reduce the severity of any long-term effects. Now that we've covered these life-saving tips, it's clear that being prepared, especially when facing a heart attack or stroke alone after 60, is essential. None of us wants to imagine being in such a vulnerable situation, but the reality is that it can happen to anyone. And sometimes, help isn't right there when you need it most. Taking proactive steps, knowing what to do immediately, recognizing symptoms, staying calm, calling for help, and using what's around you can be the difference between life and death. You might think, I'm healthy. I don't need to worry about this. Or, I have family around, so I'll be fine. While that hope is natural, life is unpredictable. Preparing yourself with knowledge and practical steps is the best way to protect your independence and your life. Share what you've learned. Take a moment to reflect on these tips. Which one resonated most with you? How will you use this knowledge to protect your health? Your experiences are valuable, and sharing them can help build a supportive community where seniors empower each other. If this video has helped you, please like, subscribe, and share it with others who might benefit. Your support helps us create more content that informs, uplifts, and inspires. Together, we can face these challenges with confidence and courage. Thank you for joining us today. Stay safe, stay informed, and remember, you have the power to protect your life, even in the toughest moments. We look forward to seeing you in the next video.